So of course, at this point, and very frequently with horses with spinal cord compression in the neck, we have a combination of both ataxia and paresis. Now, why can that occur? Well, let's have a look at this particular video, and hopefully what you can see, this is a horse with very profound ataxia in the pelvic limbs. It also has a very marked truncal sway, but the horse has inability to support itself. It has a rather bouncy pelvic limb gait. It also has difficulties in front. Every so often it knuckles, it catches the toe. So a combination of both paresis and ataxia in this particular animal. I personally think that telling the difference between ataxia and paresis can be quite difficult, and for that reason, of course, we all take the easy option and just say the animal is both ataxic and weak. Now, if we go back to the slide, hopefully what you can see here is an illustration of how it's possible to get both a problem with ataxia, and the ataxia is mediated by compression of the ascending proprioceptive tracts, primarily in the dorsal and dorsolateral aspects of the spinal cord, and of course paresis because of compression of the descending upper motor neurons in the spinal cord as well. Well, the answer is that there are several things that you can look at on a radiograph, in a lateral radiograph, to help you. The first thing is that it's possible to identify the caudal aspect of C2, the axis, because it has a rather different shape, and in particular the facet joint, or the articular process joint, there has a slightly different shape to all of the others. So this black arrowhead here is identifying that. And of course, once you know that that's C2, then it's very easy to count down C3, C4, C5. What do you do, on the other hand, if you don't have any of the axis or C2 in your radiograph? And of course that is commonly the case. Well, in that case, if you have three vertebrae that all look the same on a cervical radiograph, you know you must be dealing with C3, then C4, and then C5. So in this particular example, this vertebra here looks really rather similar to C4, and also looks very similar to C5. So from that you would know that you're dealing with 3, 4, and 5, and so therefore the one that I was asking you about was this one here, C4. The other thing that I wanted to comment on in this particular radiograph was the importance of trying to obtain true laterals of these horses' necks. So how do you know if you've got a true lateral? Well, the first thing that you should look at is what's shown here in the asterisk. These are the ventrolateral, sometimes known as transverse processes of the vertebrae, and of course there's one on each side. If you can only effectively see one of these, it means that they're overlying each other and you've got a true lateral. Now, very commonly, in my experience anyway, what you find is that in the middle of your radiograph, you get a nice lateral projection, but towards the periphery, you tend to lose that, which is what's shown as this arrow here. And what you can see is that we've got one ventrolateral process on one side here, but it's not overlying the other one on this side here. And that tells me that actually, towards the periphery of this radiograph, we haven't got a perfect lateral. The other thing that you can do is you should, on a good quality radiograph, be able to see clearly the floor and the roof of the spinal canal. And both of those things are important when we come on to talking about measurements shortly.